If you own an EMS horse or pony, then you probably already spend a huge amount of time trying to manage every part of their diet correctly. You monitor sugar intake carefully, you worry about grass levels after rain, you soak hay, you check body condition constantly, and for many owners, daily life starts revolving around preventing one thing above all: laminitis. For horses with equine metabolic syndrome, insulin dysregulation, or chronic laminitis risk, restricting pasture access is often one of the most important management tools available. Reducing non-structural carbohydrates can dramatically lower the risk of painful and potentially devastating laminitic episodes. In many cases, careful grazing management truly can save a horse's life. But there is another side to this management strategy that many owners are never warned about. Because when fresh pasture disappears from the diet, something else disappears too: vitamin E. And for many metabolically managed horses, this creates a hidden nutritional deficiency that can quietly develop over months or even years without owners realizing it. Today, more horses than ever are being managed with dry lots, track systems, grazing muzzles, restricted turnout schedules, or hay-only diets. Horse owners have become far more educated about insulin resistance in horses, equine metabolic syndrome, sugar content in forage, and laminitis prevention. That education has been incredibly important for improving horse welfare. But at the same time, many horses are no longer consuming the fresh green forage they evolved to eat almost continuously throughout the day. And that matters because fresh pasture is the horse's primary natural source of vitamin E. Stored hay simply does not provide the same levels. In fact, once forage is cut, dried, baled, and stored, vitamin E concentrations begin dropping rapidly. Over time, the nutrient content continues declining, especially if hay is stored for long periods or exposed to heat and sunlight. So even when a horse appears to be receiving plenty of forage, they may still be deficient in important nutrients, and this problem can become even more significant in horses fed soaked hay. Soaking hay is often an excellent tool for reducing sugar content and making forage safer for horses with EMS or insulin dysregulation. But soaking can also reduce water-soluble nutrients and further contribute to nutritional imbalances if the diet is not evaluated carefully. That creates a situation where many horses are metabolically safer from a laminitis perspective, but nutritionally vulnerable in another way. And this is where things can become confusing for owners, because vitamin E deficiency does not always look dramatic in the beginning. Many EMS horses do not appear thin or malnourished at all. Some are overweight. Some maintain large fat deposits while simultaneously struggling with poor muscle development and weak top lines. Owners often feel frustrated because they are doing everything correctly, yet the horse still does not seem fully healthy or comfortable. The horse may struggle to build muscle despite appropriate calories and exercise. They may feel weak behind under saddle. They may become tired more easily than expected. Some horses feel flat in their work or resistant during training sessions. Others seem stiff, uncomfortable, or unable to properly carry themselves despite consistent conditioning. And because these signs can be subtle, they are often blamed on fitness, training, age, laziness, behavior, or lack of conditioning. But sometimes the underlying issue is nutritional. Vitamin E plays a major role in protecting muscle cells and nerve tissue from oxidative damage. It is an essential antioxidant involved in muscle function, neuromuscular health, cellular protection, and recovery after exercise. When horses do not receive adequate vitamin E intake over time, muscle function may gradually become compromised. And in horses already dealing with metabolic disease, these effects may become even more noticeable. This is especially important for ridden horses, older horses, and performance horses where muscle strength, balance, and recovery are already under great physical demands. Some horses may struggle to maintain top line no matter how carefully they are conditioned. Others may lose muscle across the back, neck, or hindquarters, despite appearing overweight overall. In some cases, owners describe their horses as simply not feeling right. And that feeling should not always be ignored. The reality is that many owners are doing an excellent job managing EMS, while unintentionally creating another nutritional imbalance at the same time. That does not mean pasture restriction is wrong. It means metabolic management has to evolve more than just reducing sugar intake. The entire diet matters. And this is why vitamin E deficiency is so commonly seen in horses that are on long-term pasture restriction, maintained primarily on hay-based diets, fed soaked hay regularly, are living in dry lots or track systems, are wearing grazing muzzles for extended periods of time, receiving little or no fresh forage access, and not receiving targeted vitamin E supplementation. One of the biggest challenges with vitamin E deficiency is that it cannot reliably be diagnosed based on appearance alone. Some horses show clear muscle loss. Others only showed mild weakness or vague performance challenges. Some appear uncomfortable under saddle without obvious lameness, and others simply plateau in their conditioning despite appropriate work and feeding. This is why blood testing is so important. The only dependable way to accurately assess vitamin E status is through serum or plasma vitamin E testing. But even testing itself is not always straightforward. Vitamin E samples need to be collected, stored, and processed carefully because light exposure, delayed handling, and storage conditions can affect results. Interpretation should always be done in the context of the individual horse, including their forage intake, workload, muscle condition, clinical signs, and overall metabolic health. Because no two EMS horses are exactly alike. Some horses tolerate restricted diets surprisingly well. Others appear much more sensitive to nutritional deficiencies and muscular stress. Factors like age, forage, quality, workload, genetics, and underlying disease all influence how these horses respond over time. As awareness of equine metabolic syndrome and insulin dysregulation continues to grow throughout the horse world, conversations about nutritional balance are becoming increasingly important too. Horse owners today understand more than ever about sugars, starches, and laminitis prevention. Now, veterinarians and equine nutritionists are encouraging owners to think about the nutrients that may also be missing from heavily restricted diets. Because preventing laminitis is absolutely critical, but supporting long-term muscle health, nerve function, comfort, performance, and overall quality of life matters too. If your horse struggles to maintain topline, feels weak under saddle, seems difficult to condition, or simply does not feel as strong and healthy as expected, despite careful management, this may be an important conversation to have with your veterinarian or equine nutritionist. Understanding the connection between vitamin E deficiency and EMS may help explain problems many owners have been trying to solve for years. And as more horses continue living on carefully controlled feeding programs, this is likely a topic the horse world will be talking about much more in the future.